Our next speaker has worked in the addiction treatment and recovery sphere for nearly 15 years. He is instrumental in the growth and development of collegiate recovery programs in North Carolina and nationwide. He has been recognized by his alma mater for his efforts directly tied to the success and advocacy of college recovery. This afternoon, he shares with you his talk. Grab a shovel, treat the soil. Please welcome to the stage Mr. Jarmichael Harris.
Follow me for just a second. Imagine this tree here. Dry, desperate, desolate, in a barren desert. It hasn't produced any leaves, fruit, or anything worthwhile in quite some time. It's holding on, but just barely. And then, a refuge organization comes in, scoops up the tree, carries it to a sanctuary where it gives it everything that it needs to thrive: water, sunlight, nutrients. And within a couple of weeks, the tree begins to live again. It's bright, vibrant. The vegetation has come back. You're even starting to see a few buds of fruit. We celebrate the tree. We say, look at this amazing transformation. And then we pick that tree back up and send it right back to the desert. In just a matter of weeks, the tree is back essentially where we found it, starting right over from the beginning. Now I ask you, based on what we know of the tree, do we solely blame the tree? Or is there something different about the environment that we really need to examine? This illustration that I'm sharing with you comes to us from Don Coyes, the founder of White Bison and the Wellbriety movement. What Don shares with us here is a powerful image or illustration of what he refers to as the healing forest. Now, the amazing thing about the healing forest is this isn't some mythical, made-up place. In fact, it has the potential to be in each and every one of us, our organizations, our communities. Let's talk numbers for a second. Currently, there are 3.7 million adolescents living with a substance use disorder. 3.7 million. Additionally, 40% of college students today meet the criteria for a substance use disorder. Fortunately, that's not the end of the story. 600,000 college students have found their healing forest through collegiate recovery communities and other peer-led recovery supports, both on their campus and in the communities that surround the campuses. 600,000 is something to celebrate. But the thing is this: I've spent a lot of time on college campuses. And one thing I know for sure is that our campuses are more desert than they are healing forest. Our campuses are riddled with stigma, judgment, and isolation. But it's not just our campuses. Our communities, they're no different. Just lots of stigma, stigma, stigma. Interestingly enough, just in a few hours that I've been here walking the block, you see it. The way that people look at individuals, their stares of judgment, their snide remarks. There are over 250 words to describe negatively an individual with a substance use disorder. You've seen the words. You may have even spoken them. The stigma runs deep. It not only affects the individual, but affects their family, their friends, other loved ones. This stigma creates silence. And we all know too well that silence equals death. It's the shame. It's the guilt. And it's the reality that we just don't treat people who use drugs well. I met Johnny in 2010 at an adolescent treatment facility in Eastern North Carolina. Johnny was funny, vibrant, energetic, and like most kids his age, he just wanted to connect. He wanted to fit in. He wanted to belong. Johnny's home environment was very much desert. As we talk about all the different social determinants of health, he was negatively impacted by almost each and every one of them. No real support at home, poverty, instability, and all of his peers pretty much faced the exact same challenges. Treatment for Johnny was a respite. Johnny cycled in and out of treatment with us about 3 times before he aged out of services. Johnny enjoyed being in treatment. I often say that 90% of my job at that point in time was teaching kids how to be kids. It was palpable. Whether we were playing basketball, playing cards, or just simply sitting down for a meal together, you could tell that the weight of the world was lifting off of these children. And then we packed them up and sent them right back into the desert, hoping that we've given them something to hold on to. And so the reality of all of this is, if we're not blaming the individual, we sometimes default to blaming treatment. I know I've heard it. I may have thought it a time or two. Treatment doesn't work. We're failing. We're not doing something right. But honestly, that's not the answer. In fact, we know that treatment does work. It works when it is a part of a continuum that puts the individual first and truly allows the student or the patient or whatever title, label you give the individual an opportunity to express their wants, their needs, desires, and you build that treatment plan around them. But you also connect them with a recovery ecosystem that will allow them to thrive. We have to understand that the continuum of care is not to be siloed, whether it's prevention, treatment, recovery, harm reduction, or whatever resource in between. Recognizing that we are stronger together and in unison than we ever are apart. But also, we have to remember grassroots efforts are the lifeline of the work that we do. If we are to utilize peer support specialists, community health workers, we must value their input, their lived experience, and their expertise, and pay them as such. The work they do is absolutely invaluable. It's the connection that they have with our individuals because they've been there. They know what it's like to be in the desert, and hopefully they found a healing forest that they've also connected with, and they can introduce and have that conversation, and they do all of those things. But again, it has to be a part of a continuum that values the healing forest. In collaboration, recognizing that every individual in this seat, every organization that you represent, and the communities that you come from, as bad as you might want to support, provide, solve the world's problems, I assure you that you will do far more together than you ever will alone. And you might even be surprised about where connection or collaboration might take you. Before I left Eastern North Carolina, I actually had an opportunity to work with the local sheriff's department who was about to implement a opioid and heroin recovery program in the county jails. Now, can you imagine that? Law enforcement actively looking to reverse the reverb of negativity. I was excited about it, and so were they. The work that they're doing shows what can be done when we come together. But it doesn't happen without courage. Courage of each and every one of us to ask the tough questions. What is it about our system, our process, that isn't working? How is it that Johnny and every other kid like him seems to fall through the cracks? The courage to reverse that reverb of negativity in your workplace, amongst your family, in your communities. The courage to keep showing up for Johnny and every kid like him, to understand that even when the road is long, when the wins are few and far between, and just when it's hard, that we keep fighting. Because as I stated before, I don't necessarily know where Johnny ended up, but I do know where I ended up. I picked up my shovel and I headed to the campuses to help build a collegiate recovery community. A healing forest of essentially a campus-based recovery community organization that celebrates not just the small wins, but builds on them to ensure that every individual has an opportunity to heal, to thrive, and feel empowered. This doesn't just happen in a vacuum. It takes each and every one of us to stand up, grab a shovel, treat the soil. Today, there are nearly 250 collegiate recovery communities across the nation. If you're doing the math, then you realize that that's less than 3% of all college campuses have a collegiate recovery community. So I ask you now to consider where you are in your particular seat within your organization. How can you grab a shovel and go treat the soil in your community? Because I'm sure with 3.7 million individuals facing substance use disorder, there's someone that you can be supporting right now. Thank you.
Jarmichael Harris.